You know what needs to change. You know what's wrong. We gotta treat people the same. We gotta get along. Do you know the history of the country where you stand? Do you know how they treated the first people of the land? Do a little research. I know that it might hurt. Open up your mind, son. Then come back, we can rewrite. Do a little research. I know that it might hurt. Open up your mind, son. Then come back, we can rewrite. Come back, we can rewrite.
Sue Krusky, you're doing a lot of work around trauma-informed care, especially around attachment and parenting practices and things like that. What could we be learning on a broader scale that you saw in this research?
Thank you, Yvette, for dobbing me in, and thank you for the presenters for this hugely important work. I've become personally interested in the area just by view of being working in the early childhood space and seeing many parents struggle with helping their kids develop emotionally, and these kids then have difficulty regulating their emotions, and they're filling our paediatricians' rooms because the schools are asking them to have labels so they can get additional support in the education system. So they're being labelled ADHD and autism and obsessive compulsive disorder, etc., etc. And all the kids hear is something's wrong with me, and I think I'm really interested in helping parents understand their childhood story and how that impacts on their ability to parent, and doing that in a way that doesn't re-traumatise. So yeah, just really interested to hear your thoughts about that.
So I might go over to you, Jasmine, and then I'm going to hand it over to Kyleen to follow up on your response. So Jasmine?
Yep, I'm sorry if I misheard the question. Was it around engaging with early childhood and trauma-informed approaches?
Well, using trauma in the parenting well-child service space, so helping our parents understand their own childhood story and how that then is brought into our own experiences of parenting.
I'm happy to answer this one. So the first thing that we do in our relationships when we are engaging is we do establish that safety. And then we start to learn their story, because it's not about them understanding their story, it's about them needing to understand how their story has impacted them. And then that starts to make sense. Otherwise, yeah. And it really does affect the way in which parents parent and how children respond to that. And then the cycle goes on. So if you look at Aboriginal people, we've been disconnected. So not only from our country, but from our parents, from our families, from our communities. That's humongous, and that's happened over a long period of time. And there has never been any formal healing frameworks in place to address these issues. And one thing that we know about trauma is trauma gets stored in our bodies. And then you look at Aboriginal people and the chronic diseases that we do have, it makes sense, yeah?
Thank you for that response. Jeff, you didn't present research, but you're very much involved with the community organisation that is involved with research, and the topic is Context Matters, the importance of place-based research. So listening to some of the conversations and your involvement with Purple House, what's some of the learnings that you think, or the key takeaway message for in your context?
Well, my context spreads over 40 years of working out in a remote area. And just going over some of the conversation of today, we heard earlier on about that research looks at a problem. And what I've gathered, one of the problems I've heard today is that keep looking at the data, but there's no change. And that sort of suggests to me that the status quo remains. And the context of from what I've picked up today is that First Nations from everybody here who's doing brilliant work, that First Nation people's health matters, but also the role of research in that, and the context involving the lens of the system, challenging the power, and there was a comment about requires power to care, but I would ask, is that sufficient? Is that what the improvement in First Nations people health comes down to? The significant inequities, that power needs to be flipped, and again, balancing the power issue. In terms of the place-based research, looking at the national and the local, there was a statement put out called the Uluru Statement in 2017, which involved an extensive consultation process with First Nation people. It seems to me that that's actually community-based research, and that was their outcome from that, and that for them, for First Nations people, was a prescription for their well-being. So my kind of question then comes to, how does research support that prescription and challenge and flip the power? There was a comment made by Megan Davis, First Nations person's constitutional lawyer, who was heavily involved in the development of the Uluru Statement, that said the status quo is killing us. So that's where I think some of the focus of research really needs to have a look at, and I can't come across a lot of examples of where research is actually researching up. A lot of research down, but not up, and I think maybe that's an issue we need to think about.
Thank you. Deborah, in response to, or not in response, considering what Jeff has just mentioned in the light of your research, how does your research link with something as powerful as the Uluru Statement? Or have you thought of it in that context?
Yeah, no, that's a really difficult one. I think just reflecting back on what Jeff was saying, that yes, the status quo is killing us, but the research, at least that was being addressed in this research, was really to test whether or not the status was staying the same, even with these changes that to the different model of care that theoretically would you would think would improve outcomes. And I guess yes, we don't know that the health outcomes for people have changed at all yet, but we do know that at least the processes towards getting better health outcomes appear to have changed in a positive direction. Yeah.
Anybody else's response to the comment about how our research needs to link to such an important document? I'll throw it out to you, Alex.
You love it.
Come and sit up here. Come up here.
No, you're right. Black's in the back. So, I mean, being asked, is your research architecture, the moral and ethic of the work that you do consistent with the Uluru Statement? Is like saying, so how do you breathe, right? We do it that way because that is the impulse of the people who guide us in the research that we do, which is community. So, to break it down though, because you can actually break down how you breathe, I mean, we accept and completely are consistent with this notion of Aboriginal sovereignty, that it was never ceded, and therefore our bosses are the communities in which we are supposed to serve. So all of our research is framed in that construct, very purposefully. At the other end of the Uluru Statement, there's really about Aboriginal children, the next generation, walking confidently and capably in two worlds and getting the best of both. I mean, this has always been the narrative. It's hard to do, but our view is that we can't actually grow the next generation of Aboriginal kids if we're not giving them access to the knowledge and wisdom and benefits of both worlds. And that's hard to do, but certainly a frame of reference for the work that we do. We probably have underdeveloped our work around prison health and incarceration, largely because there's a coercive nature of doing research in prison environments, because people have got nothing to do. They're used to being told what to do every minute of the day, and rolling in a research project into that context is something I've always been very mindful of. That doesn't mean we don't understand that the incarceration issue facing our communities, from juvenile justice right through to Big House and beyond, is causing enormous harm on every level for our communities. We're overrepresented, we're downtrodden, we don't get a fair rub of the green when it comes to justice in this country. So all of those things do frame our understanding of inequality, but we haven't done specific work in that. And then the last bit that we really pick up on, but probably need to develop more strongly, is unceded territories and the importance of country and to our well-being, both as a preventive strategy but also as a restorative strategy. I think we've underdone that work in research, and I think places like Central Australia and the middle of the country should be the place that leads that narrative in both a political advocacy perspective but also in a research perspective. So I think it's central to all we do because we were beaten up by the same people who got the Uluru Statement in play.
All right, Jasmine, your comments?
I was going to echo a little bit about that, but as not being Aboriginal, I would want to speak to the relevance of Uluru Statement apart from the recognition of sovereignty and whose voices get centred and whose voices get privileged in the research process. And that's why I think even focusing on this theme of context matters, the importance of place-based research speaks to that very strongly. And look, we have a TO Uluru here with us, and so I'd much prefer for Kyleen to speak to the narrative that Alex was just speaking about in terms of the restorative nature of being on country and healing.
So on that note, Kyleen, I might give you the last comment on this important statement. Wait a minute, I just got to get you here. Our young fella got to run you a microphone first.
Thank you. I'm going to be really honest and say I've heard lots and lots about the Uluru Statement. I got about halfway through it. I was actually delivering my youngest child when the Uluru Statement came about. And so I just never really got into reading it, but I've heard comments here and there about it. And I also know that my family out at Uluru don't like how it's been represented because, you know, they're saying that it's a representation of who we are as Arnangal people, TOs from Uluru, when it's a collective from Aboriginal people all over Australia. So, you know, a lot of my family have disassociated themselves from the Uluru Statement. But in terms of what Professor Alex was saying, that connection to country is really important. And, you know, what we talk about in our trauma-informed training is about how connection to country and in our kinship, it's central to our identities as Aboriginal people. It's been in existence for 65,000 years plus. So this is something that we're born into. It's not something that comes to life after we're born. So as Aboriginal people, we have a humongous responsibility to take care of our country, and that means being connected on country. Healing takes place on country, and our country looks after us as we look after it. So that's our mentality about it. We're not separate from the country. We're connected to the country. We are the country. So when you remove us from the country, we're not whole. And this is exactly what happened with the assimilation policy. This is what's going on today with the removals of children from territory families. We're still seeing the same problems that we've seen years and years ago. My grandparents, both of my grandparents, on both sides of my family, are stolen generation. The impacts of that are still living today. I can't speak my language. 4 or 5 languages I can't speak. I can only speak English. It's not my choice. So the impact of that is really great. And it also puts another burden and a disconnection on the way that I connect with my people, my family.
I think it's important to remember that, or acknowledge that not every Aboriginal person in this country supports the Uluru Statement. Not every one of us supports constitutional recognition. You know, that there's still enormous conversations be happening around that, and until we sort that out, from my perspective, the Uluru Statement was being driven by the uptown side of camp, you know, and until we address the social determinants for a lot of our people, then the Uluru Statement is going to just be some fancy thing that came from Canberra, basically. It's not going to have real meaning until, you know, those other determinants are met. And it's part of the story, but it's not the whole story. It's got to be more than that.
Yeah. Thank you very much. I think that's a terrific summary. So a round of applause for our speakers for this last session.
You know who needs to go.